So now we're switching gears to chapter 20, which focuses on the respiratory system. So for this chapter, we're going to focus on the structures of the respiratory system and talk about some of the major functions that the respiratory system takes care of. We'll also talk about how air moves in and out of the lungs and the development of the respiratory system in a developing embryo. For this video, though, we're just going to focus on kind of a respiratory overview, looking at the organs and structures we find within the respiratory system, both on the large scale as well as the histology. So there's really two main zones of the respiratory system, the conducting zone and the respiratory zone. The conducting zone is basically like the delivery system of air. So the conducting zone is not responsible for doing any sort of gas exchange. It's just to bring in air, warm it up, clean it up, moisten it, right? Prepare the air for gas exchange. So the nose, the mouth, the pharynx, the larynx, the trachea, the bronchi, and the bronchioles will all be responsible for that. The respiratory zone is where we're actually doing the gas exchange. So the respiratory bronchioles that we see deep in the lungs, and then the alveoli at the very end, those will be actually responsible for exchanging carbon dioxide and oxygen. If we look at the major structures, we have the nasal cavity and the nostrils, sometimes called the nares, so you may see nares as well. We have the oral cavity because we can breathe through our mouth as well. Both the nasal cavity and oral cavity will fall back to the pharynx, which then leads down to the larynx, which then leads down to the trachea, each of the bronchi. So we have a left and a right bronchus, each one going to their respective lungs. There are bronchioles and alveoli inside of each of these lungs as well. So if we take a look at the nose, so we have the dorsum nasi, which is like the bridge of your nose, right? Like what you think of when you think of a nose. The ala, which is like the edges of the nostrils, the apex, which is the tip of your nose, and then the philtrum, which is just down below, kind of like that little like that area that makes your cupid's bow for your lips. That's the philtrum. If we look underneath the skin, right, we have different cartilages to help form most of the nose. We do have the nasal bones and the maxillary bones to help form kind of a part of this nose, but most of it is going to come from cartilage, in which we have septal cartilage and major alar cartilage. If we take a peek, and I know there's a lot on here, so bear with me. We're going to get through it. We're going to go through it piece by piece. Some of these are sinuses we've already seen, like the sphenoidal and the frontal sinuses. We've seen those. We've seen the olfactory epithelium coming through the ethmoid bone already. We've briefly talked about the nasal conchae because of the ethmoid bone, right, forming those ridges that we can kind of circulate air through, kind of toss the air around a little bit. The external nares, that's going to be, again, your nostril. Right. The hard and soft palate, which are going to divide the oral cavity from the nasal cavity. The internal nares, though, like that's all going to be like way deep here. Like, so the external nares, that's like, that's like if a child like picks their nose, that's what they're doing, right? They're touching the external nares. The internal nares is like, you're not touching that. If you're touching that, you've gone way too far. There's damage that's been done. We have the opening to the auditory tube or the eustachian tube to help equalize ear pressure, like on the inside of your, like the middle ear. Working our way down, we have the little uvula. That's the little dangly thing you see in the back of your throat, right? The tongue. We have the different tonsils. We do see the pharyngeal tonsil up here, the palatine tonsil, which is what you think of when you think of tonsils, and then the lingual tonsil. The pharynx can be broken down into three regions: the nasopharynx, which connects to the nasal cavity, the oropharynx, which is going to connect to the oral cavity, and then the laryngopharynx, which is going to go down further. Continuing over with the larynx, we have the epiglottis, The epiglottis is important for covering the larynx when we are eating and drinking. That way food and drink does not get down into our airway. So it will basically serve as a nice little covering over the top of your larynx to protect your airway from unfamiliar or foreign substances from getting into it. Moving our way down, we have various cartilages in place that will give this larynx, that will give like the epiglottis and larynx structure. It's like the thyroid cartilage and the cricoid cartilage, the thyroid down here. This is going to be the trachea and the esophagus. So the trachea is anterior to the esophagus. Within this larynx, we also have the folds, the vestibular and the vocal folds. The vocal folds, that's going to be your voice box, right? So a lot of things on this slide, a lot of things, but some of these, should be familiar, should be somewhat familiar, and others should be like, oh yeah, that makes sense. Within that trachea, we have some structures to help provide some protection against the pathogens and debris that can be in the air we breathe in. So within the trachea, we find pseudostratified columnar epithelia, and ingrained in that, we have goblet cells that produce mucus. So in this, we see like the white space is the lumen, the open space of the trachea. We see goblet cells that are producing mucus, and then the cilia, which are going to act almost like little brooms, right, to sweep any debris caught in that mucus up and out. When we look at the pharynx, I mentioned this already, that we have three kind of regions. We have the nasopharynx, the oropharynx, and laryngopharynx. Nasopharynx is showing in green, and that's what's going to connect the nasal cavity to the pharynx. In blue, we have the oropharynx, which is connecting to the oral cavity, and then in purple, this is beyond any openings. We're down towards the larynx. So if we look at the kind of exposed larynx, right, not a sagittal cut, but like actually seeing it, if we look at it from the front, right at the very top there in beige, we have the hyoid bone, we have the thyrohyoid membrane, the thyroid cartilage, which almost is kind of shaped, I guess you could say, like the thyroid, although the cricoid cartilage is kind of more butterfly shaped. There's a laryngeal prominence. This is where you're going to get like your Adam's apple from. The cricothyroid ligament, which runs between the thyroid cartilage and the cricoid cartilage. And then the tracheal cartilages, which these are going to be like these little ribs. Now, we can't really feel this on ourselves, not without pushing and being very uncomfortable. But if you ever do like a dissection and you run your thumbnail across that trachea, you can actually feel the ridges of the tracheal cartilages. Lastly, we have the cricotracheal ligament, which runs between the cricoid cartilage and the tracheal cartilages. So if you remember the thyroid, the cricoid, and the tracheal cartilages, and you remember which one's which, then the ligaments should come pretty easily because they're just named for the things that are connected to them. Moving down, if we were to look at the inside of this, we're looking at a sagittal view here. We see a couple other things, or we see them in a slightly different format. Right, so we see that thyrohyoid membrane that we saw right up here. We see a part of the thyroid cartilage and a part of the cricoid cartilage. We see a part of the tracheal cartilages. But the big thing is seeing those vocal folds, right? Those vocal folds that are going to allow you to speak. In the back here that we couldn't see before, we also have a few other cartilages, the cuneiform, the corniculate, and the arytenoid. Those ones, I don't have a trick for remembering them, unfortunately. If we take a look at the glottis is just the opening, right? This open space that we can come in and go through. We have the vestibular folds that are kind of more on the lateral sides, and then more towards the middle we have what are called the true vocal folds. And that again is going to be what vibrates as you breathe in and out, or as you talk, right, and air is pushed past them. That is what's going to cause that sound. And again, the epiglottis is going to cover the glottis. It's going to cover this opening so that when we eat or we drink, that food, water, whatever we're consuming does not accidentally get in our airway. With the trachea, again, the trachea is going to be closer to the front of your throat. It's going to be anterior to the esophagus. And unlike the esophagus, which you kind of see is kind of like oval, right? We're going to be very structured, very round, and held out with that cartilage. We have a few layers to this. We have the mucosa on the very inside, right? This is going to have things like some connective tissue and epithelial tissues. We have the submucosa. Beyond that, we have cartilage, and then the adventitia, which will be on the very, very outside. Those are really the main things that I'm concerned about with the trachea, knowing like the basic kind of structure, mucosa, submucosa, cartilage, and outer lining of adventitia. If we continue down from the larynx down the trachea, we get to the bronchial tree. And you can see why it's called a tree, because it looks like a tree that's been turned upside down. We see that there is one bronchus per lung, right? One main trunk, right, leading into each one. And then each of those primary bronchi are going to break into secondary and tertiary ones. Kind of like how a main tree trunk would branch into smaller branches and smaller branches and smaller branches till you get to like thin twigs and leaves. Same kind of setup here with the bronchi. So if we look at the structures of the bronchial tree, we have the trachea. This is again like the tree trunk. This is going to bring air through the mediastinum to the main bronchi. We get to the main or the primary bronchus. This is branching from the trachea to split into each lung. The lobar bronchus is going to go to each lobe, so 3 on the right, 2 on the left. The segmental or the tertiary will then go from the lobes to each of the segments, and then the bronchioles will go from a segment to an actual respiratory zone where we get to the alveoli where we're doing the actual real gas exchange. This really is the meat and potatoes, right? This is where the magic is happening. This is the alveol. In this case, we're talking about one, so an alveolus. This is going to be where we perform gas exchange. So you see they almost look like little like blackberries, right? They almost look like a little berry shape. But inside it's like basically like a little sac where we have air. And it's really, really thin, right? We have really, really thin, like simple squamous type tissue here. And then covering each of the alveoli, we have like a net of capillaries, which are also really thin. So we only have like a couple layers of cells to get through to do this exchange. This is all going to work on partial pressure, which we'll get into deeper in like physiology, but basically we're looking at saying, okay, you have a certain like pressure or concentration of oxygen on one side, a certain pressure or concentration of carbon dioxide on the other. They're going to be pushed from one side to the other because of that difference. And the reason they can travel and this can happen so easily is because the alveolus structure is so thin, as well as the capillary system being that thin too. So we look up close, right, in the alveolus. We have a few different types of cells here. So the alveolus is like the actual space. And then we have all these other types of cells. So let's go ahead and talk about each of these types of cells in here. So we have the macrophages, which are going to be part of like an immune response, right? They can help phagocytize anything that's not supposed to be there. We have capillaries, which are going to have blood so we can do our exchange. And then we have these type 1 and type 2 alveolar cells. You might be wondering, well, what do these guys do? The type 1 alveolar cells are going to be the ones really doing the gas exchange process, right? They're the ones involved with exchanging the carbon dioxide and oxygen. The type 2 are going to be responsible for producing things like a surfactant. This is going to help prevent the alveolus from collapsing in on itself. Now, one thing that can go wrong with the lungs is a condition called asthma. So we're going to look at what normal tissues look like in the bronchi, and then we're also going to look at asthmatic ones. So if we look at the top, we see normal. So we see there's mucus, we see there's goblet cells, the epithelium, the basement membrane, the lamina propria, and smooth muscle. But when we look deeper down in on the bottom here at the asthmatic tissue, we see first of all mucus production is way up. And when we're looking in that lamina propria, rather than just have like some white blood cells, we have an army, right? There's mast cells, there's macrophages, there's eosinophils, right? There's neutrophils. We see all sorts of white blood cells involved. So that's one of the reasons why this can be so problematic, right? Asthma can be so problematic. We have an overproduction of mucus, the glands are going crazy, the white blood cells are going crazy and overreacting to mild irritants.